Hello, my name is Tamika Hobson. I'm a nursing student at Indiana State University, and this is my Community Health 444 project on sickle cell anemia. Before watching this presentation, I ask that you go to the description box and take the pretest. None of the results will be recorded. It is just to assess your knowledge before viewing the presentation. At the end of this presentation, you will take the test again, the post-test, and it will evaluate how well this presentation educated you on this subject. Pause the presentation at this time. Now that you've taken the pretest, here are the objectives for this PowerPoint presentation. After viewing it, you should be able to state the role of hemoglobin in the body, recall who is at risk for sickle cell anemia, describe what happens when a person has sickle cell anemia, summarize what sickle cell crisis is, outline what triggers a crisis, report how to prevent a crisis, construct a list of signs, symptoms of sickle cell anemia and crisis, explain how sickle cell is diagnosed, and describe treatment for sickle cell anemia. In order to understand sickle cell anemia, we must first know what is hemoglobin. Hemoglobin is a molecule that is found in red blood cells. It helps the red blood cells to bind with oxygen in the blood, and it delivers that oxygen to cells throughout the body for use in their normal functions. And it does this as the blood travels through the blood vessels. What is sickle cell anemia? In those with sickle cell anemia, the hemoglobin gene is mutated, and they have a mutated version of hemoglobin called hemoglobin S, and it works like normal hemoglobin, which is hemoglobin A, as long as there's enough oxygen. When oxygen levels decrease in the body, that hemoglobin S forms strands inside of the red blood cells that causes the red blood cells to change into a sickled shape. This shape doesn't flow as easily through blood vessels, and it is prone to breaking and also getting stuck. There are two major forms of sickle cell anemia. The first one is the sickle cell trait. This is where there's one copy of mutated globin gene, hemoglobin S, and one normal copy of hemoglobin, hemoglobin A. So there's a mixture of hemoglobin S and hemoglobin A in the body. So the people with this rarely show signs and symptoms of sickle cell anemia. They're simply carriers of the disease capable of passing the trait on to their children. The other is sickle cell disease. There are two main ways that you can get sickle cell disease expression. The first way is when there's two copies of the mutated globin gene, hemoglobin S. Because most of the hemoglobin is hemoglobin S and the very little is hemoglobin A, these people show signs and symptoms of the disease. This is the most severe form of sickle cell anemia. The other form of sickle cell disease that is expressed is when there is one copy of the mutated globin gene, hemoglobin S, and some other abnormal globin gene. There is co-inheritance of a different type of mutation and a sickle cell mutation. And because there is not a normal version of hemoglobin, the sickle cell traits come through and are expressed in these people. Those with one parent with the gene for sickle cell are at risk of becoming carriers. Those with two parents with the gene for sickle cell more than likely will display some sickle cell anemia characteristics. We can look at the picture on the right to determine the chances of that. So if both of your parents have one normal copy of hemoglobin, which is hemoglobin A, and one mutated copy of hemoglobin, which is hemoglobin S, there's a 25% chance that you will have two normal copies of hemoglobin. There's a 50% chance that you will have one normal copy of hemoglobin and one mutated copy of hemoglobin. And there is a 25% chance that you will have two abnormal forms of hemoglobin. To check for sickle cell, we always look at family history of sickle cell trait or disease, because in order for a person to have this disease, someone in their family has to have had the gene for it. And there can be sickle cell screening tests, uh, hemoglobin electrophoresis to look at your cells, and those who have sickle cell, it normally first appears about 6 months to 1 year old, and at that time there's usually some hemolytic anemia and some visual occlusions found. Sickle cell crisis. Well, during the sickle cell crisis, what happens is there's suddenly a lot of pain. It's very painful. And this happens when there is decreased levels of oxygen that affects the hemoglobin S. And remember before we said that hemoglobin S, it acts normally in the presence of adequate oxygen. But when the oxygen level goes down, it causes the hemoglobin S to form strands inside of the red blood cells. And these strands are what cause the red blood cells to take on that typical sickling shape found in sickle cell anemia. And the sickled red blood cells are stiff, sticky, they break easily, and they get stuck in small vessels and compromise blood flow. And what this does is it basically blocks blood flow from flowing into the area of body where these cells are clumped together. And this can cause a stroke, MIs, which are heart attacks. It can cause pain, cell tissue, and death because blood is not able to reach that area of the body. So oxygen is not able to reach that area of the body. It could cause pulmonary embolism, which is a blood clot in your lungs, infarction, and damage to the spleen, which is when blood flow is sort of cut off and it causes areas to die. It can cause renal failure because there's decreased blood flow to your kidneys. It can cause osteomyelitis, which is an infection in your bone, chronic joint pains and problems as those cells get stuck in the areas in the joint, priapism in men, which is when you get an erection that will not go away and it can result in tissue death, and stasis ulcers in your lower legs. So what triggers a crisis? A crisis can be triggered by fever and infection, extremes in temperature, such as being too hot or too cold, stress, excessive exercise, hypoxia, smoking, and dehydration. All of these things can compromise oxygen and put more stress on the body, which will trigger that sickling shape in the red blood cells. How do we prevent a crisis? Well, staying hydrated to avoid dehydration, avoiding high altitudes, not smoking, vaccinations to prevent illness, managing your stress, and mild exercise can all help prevent that sickling of the blood cells and prevent the crisis. Signs and symptoms of sickle cell anemia and crisis include sudden pain caused by lack of or decreased blood flow to a particular part of the body, organ dysfunction, because remember, they're not getting the blood flow, which means they aren't getting oxygen, so they can't function properly, increased heart rate, tenderness, fever, a decrease in hemoglobin, and a decrease in red blood cells because remember that hemoglobin S, it makes those blood cells easier to break and sticky, and so the levels in the body tend to go down. Treatment for sickle cell anemia include allogeneic hematologic stem cell transplant, and that's fairly new. Treat underlying causes of the crisis, supportive therapy including drug treatment such as hydroxyurea, IV fluids for hydration, blood transfusions, and pain management. And that completes our presentation. Please take the post test and see how well I did. Thank you and have a good